आज बहुत माजरत थोड़ी सी ताख़ीर के साथ ऑन एयर आने में, लेकिन जिस तरह की कई चीज़ें हमारी ज़िंदगी में प्लान नहीं होती हैं। व्हेन आई वाज ऑन माय वे टू द स्टूडियो वी मेट विद अ बिग एक्सीडेंट। अल्हम्दुलिल्लाह मुझे ऐसा लगा कि फ़ौरी तौर पे मदद आ गई और जो ज़ख्मी थे उनको हस्पताल की तरफ लेके गए, लेकिन इट वाज़ क्वाइट अ हैरोइंग एक्सपीरियंस। तो अल्लाह करे कि जितने लोग भी अपनी मंजिल मकसूद की तरफ सफ़र कर रहे हैं खैरियत के साथ अपनी अपनी मंजिलों पर पहुँचें। आइए सबसे पहले आगाज़ करते हैं एक बहुत ही स्पेशल मेहमान के साथ। आज हम बात कर रहे हैं विद द CEO ऑफ ब्रिटिश एशियन ट्रस्ट, जो 3 साल के बाद पाकिस्तान के दौरे पे आए हैं। कराची, लाहौर, इस्लामाबाद मुख्तलिफ शहरों में इन्होंने विज़िट किया और अपनी पार्टनरशिप्स के तहत चलने वाले मुख्तलिफ प्रोग्राम्स को इन्होंने रिव्यू किया। आपको बताते चलें कि ब्रिटिश एशियन ट्रस्ट का इस वक्त एक बहुत बड़ा फोकस पाकिस्तान में एक बड़े मेंटल हेल्थ प्रोजेक्ट को लेकर है। यानी ख़ास तौर पर जहाँ हम कहते हैं कि आबादी के एक बड़े तनासुब में मुख्तलिफ किस्म के जहनी अमराज पाए जाते हैं, स्ट्रेस है, डिप्रेशन है, और उसको एड्रेस करने के लिए एक स्केल्ड अप पॉलिसी की और एक इंटीग्रेटेड प्रोग्राम की ज़रूरत है। पहली दफ़ा हमने देखा कि एक साल भर की कमिटमेंट की गई है ताकि इस मौजू को हर पाकिस्तानी तक पहुँचाया जा सके। मेंटल हेल्थ इतना बड़ा फोकस क्यों है ब्रिटिश एशियन ट्रस्ट के लिए? इसके अलावा और कौन से प्रोग्राम्स हैं जो इस इंटरनेशनल फाउंडेशन के तहत पाकिस्तान में मौजूद हैं और आगे बढ़ रहे हैं? इन प्रोजेक्ट्स की क्या स्टेजेस हैं? आइए जानते हैं, आपकी मुलाकात कराते हैं रिचर्ड हॉक से, जो कि CEO हैं ब्रिटिश एशियन ट्रस्ट के। हेलो एंड टू यू रिचर्ड, हाउ हैव यू बीन?
Morning. Assalamu alaikum.
Walaikum assalam. So I understand that you've had a really invigorating week in the country. I noticed that you had an update go up on your LinkedIn announcing that you're very excited about coming to Pakistan. So did Pakistan live up to the expectations?
But Pakistan always lives up to expectations. It's a fantastic country. I've had the very good fortune of visiting Pakistan more than 20 times. This visit, I've been here more than a week already, and I absolutely love every day I spend in Pakistan.
Brilliant to know that, Richard. Mental health, I remember being a part of the launch event of it, and you've gotten a lot of partners together, a variety of mental health practitioners trying to get the best word out there and the support that many Pakistanis need. Why is mental health such an important focus area for British Asian Trust?
Well, first of all, thank you for being so supportive of the work that we're doing and having this conversation this morning. It's one of the most important things that we can do to keep talking about these issues. Globally, there is a mental health crisis. There are millions and millions of people around the world that have mental health issues. A lot of this has been made worse by coronavirus, which had a huge impact globally, and there are lots of issues with young people as well. So across the world, this is a problem. And it's no different in Pakistan. There are real challenges. There are lots of people that have high levels of anxiety, stress, depression, and so on. And what we want to be doing is working with people in Pakistan to be addressing all of this. The British Asian Trust was really driven by the Pakistani community in the UK, and there's been lots of interest in mental health in that community. And so originally that's where the drive came from. The Pakistani diaspora in the UK saying there must be something we can do about mental health here in Pakistan. So we've been working in mental health in Pakistan for 15 years, and there are now so many organisations doing things, there's so many people talking about it, and there's real momentum going to make a big difference.
And I could see that yesterday at your event as well, where you had a number of partners, including Sehat Kahani, that has been using telehealth and technology to the best of interest. Technology can be a real game changer in being a service provider or being that safe space where people can at least express what is making them anxious and stressful. What have been some of the findings when you've partnered with the likes of Sehat Kahani?
So Sehat Kahani are an amazing organisation. They're based in Karachi, and they use technology, as you said. They use technology to support people in rural communities and give access to doctors and professionals to people who wouldn't have that. What we're finding is that with mental health, you can have relatively easy interventions that can address things like depression and anxiety and stress. And just by getting people to talk about those, to feel more comfortable about that, that can stop people going into a bigger crisis.
Yes.
When people go into a bigger crisis, then you get real problems. You get people having to take a lot of time off work, so that has an impact on the economy. We know there are rising levels of death by suicide. And a lot of these things can be prevented with much lower level interventions earlier on. And so if we can work with organisations like Sehat Kahani, if we can work with healthcare professionals, with employers, to get people more aware about mental health, then people will start talking about it, they'll start having those conversations.
You're absolutely right in pointing out that so many young people seem to be prone to having really disturbing suicidal thoughts. In yesterday's seminar and in other conversations with the BAT, I've realized that young people are very prone to having these feelings of stress and anxiety. Another thing which is unique about Pakistan and many of the Asian cultures is the stigma attached to mental health. And since you've been in this space for the last 15 years, has the needle moved? Are people more receptive to asking for help and for reaching out?
So absolutely, without question, that needle is moving. And so over the last couple of years, there's been a lot of very, very good development in Pakistan so one of our ambassadors is Myra Khan, for example. We've worked with the Pakistan cricket players. And when people like that, who are really well respected in society, when they talk about mental health and say, it's perfectly okay. It's perfectly okay to feel depressed, to feel levels of stress. We just need to talk about this and accept it. And what we need in society is a recognition that mental health is as important as physical health.
Absolutely.
And if we can get those messages across that it's absolutely fine. If somebody breaks their leg, there's no stigma attached to that. Yes. It should be exactly the same if somebody has levels of anxiety or stress or depression. There is nothing wrong with that. Let's just talk about it. Let's make it perfectly normal to talk about it. And then people start to feel better about opening up and talking about it. And it stops people then going into a bigger crisis where they might need medication, they might lose their job, it might have devastating impact on them and their family.
Absolutely. Richard, what I've observed during your week in Pakistan, you've reached out to a number of policy makers, of position holders in the government. So do you feel government is also cognizant of how huge this crisis is and would like to partner with international donors, with partnerships that exist in Pakistan? Is there an appetite for that?
Yes, without question. There's an absolute appetite. There is a recognition at government level that this is an issue that we need to be doing something about, and all of the conversations I've had, people have been very receptive to doing that. I think the message we need to get across is that governments can do a lot without having to spend a lot of money. We're not asking for millions and millions and millions of rupees. We just need an environment where it's acceptable to talk about these kinds of
where
issues.
There's momentum, where there could be catalyzing conversations, where there can be safe spaces to have these conversations. Richard, it was a pleasure to have you on the show and to have you in Pakistan. Any other focus areas, important focus areas for BAT, and any message you'd like to leave my viewers with?
Well, first, thank you for having me. It's so important to have these conversations, and I really appreciate having this opportunity on your show where people can hear and realise that this is perfectly normal. The British Asian Trust, we've got a big programme in Pakistan. In addition to mental health, we have programmes supporting a lot of women and young people to become entrepreneurs, to set up businesses, to get more jobs. And so those are our big two focus areas, looking at mental health and looking at women and young people setting up businesses and getting jobs.
And I love the fact that they're both integrated. When you're in a healthy space of mind, you can see opportunities. Otherwise, they may be right around you and you will not notice it. Thank you once again for being on the show, and all the very best of luck for the variety of projects and safe travels back home.
Thank you very much. I look forward to being in Pakistan again soon.
Absolutely, we'll be looking forward to that. और इसी के साथ आपको बताते चलें कि ज़हनी सेहत, आपकी जो मेंटल हेल्थ है, उसके ऊपर हम भी बात करते रहते हैं अक्सर, लेकिन ब्रिटिश एशियन ट्रस्ट के लिए एक बहुत ही अहम ये फोकस एरिया है, ख़ास तौर पे बरतानिया में मुकीम जो एशियंस हैं, बिलखुसूस पाकिस्तानी, उन्होंने जब पाकिस्तान की सूरत हाल देखते हैं और मुख्तलिफ़ ख़बरें यहाँ से आती हुई देखते हैं, ये नंबर्स देखते हैं कि यहाँ के लोगों को ये अमराज, मेंटल हेल्थ, स्ट्रेस, एंजाइटी, डिप्रेशन किस हद तक इफ़ेक्ट करता है, तो देयरफॉर हमने देखा कि ये इंटरवेंशन की जा रही है। इसके तहत जो मुस्तनद किस्म के प्रैक्टिशनर्स हैं, उनकी भी एक डायरेक्टरी बनाई जा रही है, मुख्तलिफ प्रोग्राम्स को इनिशिएट किया जा रहा है। सेहत कहानी जैसे पार्टनर्स के साथ टेक्नोलॉजी को यूज़ करते हुए आप घर बैठे टेली हेल्थ की सर्विसेज के थ्रू भी अपने मसले को बयान कर मदद मांग सकते हैं। आई होप दैट दिस इज़ गोइंग टू हेल्प एंड दिस इज़ रीचिंग आउट टू पीपल नीड टू हैव दिस इन्फॉर्मेशन।